I'm NBC 10 News medical reporter Sherry Bank, live in Allentown, where you're about to see a smile makeover live as it's happening from beginning to the dramatic results. NBC 10 News at 4 starts now. And I'm medical reporter Sherry Bank, live in the Lehigh Valley in Allentown. And take a look where cosmetic dentist Dr. Mary Viechnicki is designing a new smile on her patient. Watch a live smile makeover next.
Now on the NBC 10 Health Watch, have you always dreamed of having that perfect smile?
That was pretty good. Well, today we're going to show you how to get it. We go along step by step as a young woman gets a smile makeover right here on live TV. NBC 10 News reporter, medical reporter Sherry Bank is live in Allentown, where this transformation is just about to happen. Sherry.
Well, Renee and Tim, you both have dazzling smiles, and you know it's so important because it makes a big difference in how you put yourself forth in this world. When you have a big, bright smile, you have more confidence, and you feel better about yourself. I'm here in Allentown live with Dr. Mary Viechnicki, and she is creating a new smile for her patient, Renee. But let's give you a little background first.
It feels warm.
Before they sit in her dental chair, patients at cosmetic dentist Mary Viechnicki's office get a hot paraffin treatment.
It feels really nice. I just want to crawl in, actually.
With mitts in place, the dentistry can begin.
It's a new anesthetic delivery system, which just doesn't hurt as much.
Renee Munzinski is here to get a new smile. She's a dental assistant and former Marine who has a rotated tooth and another tooth that's dark.
When you don't like your smile, you tend to hide behind it and you tend to talk with a closed mouth and not smile as much.
She's come to Dr. Mary Viechnicki, who designs smiles.
If you want to change your whole smile and change the shape of your teeth, and if you have a rotated tooth or spaces or just teeth that have even staining due to internal staining due to tetracycline, certain antibiotics, veneers are what you use, and you know that's what then gives you that kind of Julia Roberts wow look.
And that's what we all want, isn't
Right,
it?
exactly. I mean, who doesn't want to look like that?
For Renee's veneers, Dr. Viechnicki uses a laser to move up her gum line on two teeth to make them look longer. She shapes Renee's teeth and roughs the front surfaces to apply temporaries. State-of-the-art veneers look phenomenal, as you can see from one of Dr. Viechnicki's before and after pictures.
It gives you that natural translucency, so you don't have that opaque, all one color chiclet look where you've got, 10 blocks in the front of your mouth. Now everything, has the proper shading and line angles and translucency, so you have a more natural, beautiful look.
Now that was last week when we were here. Now let's go to Dr. Viechnicki, and I've asked her to take off all her mask and glasses and everything she was wearing before so you can talk to us better. What are you doing now with Renee?
Well, right now we just tried in each restoration individually, and they look awesome. So we're checking the fit to make sure that the fit is absolutely perfect. We showed the patient prior to this the shade to make sure that she likes the shade and the shape and the length of the teeth. And, so far it's a go. It looks great.
And how do you get the veneers onto the teeth? You don't just glue them on.
Well, no. Right now, each tooth is an intimate fit, so we just try each one on individually, and we just place some color-blended material underneath in order to have the patient see exactly what the smile is going to look like prior to permanently inserting them.
Okay, well that's great. And you think it's going to look good, don't you?
Yes.
I can tell. I can tell it's going to look great. And we're going to show you the dramatic results later on NBC 10 News live at 5 and at 6 o'clock. So we'll be back live from Allentown later.
All right, Sherry, we look forward to it. We're going to see the final result here.
Even with the static, you could see that that's going to be a dazzling smile that she has there.
They're looking good.
They do.
Sherry, I'm looking forward to what you're going to have on Live at 5 today.
Oh, Tracy, you're right. We're live in Allentown where we're showing you a smile makeover. And we're going to see what it's like to get veneers and have a beautiful smile with no blood, no pain, no drilling, and dramatic results. We'll show you later on Live at 5. Hi, I'm NBC 10 News medical reporter Sherry Bank, live in Allentown, where we are showing you a smile makeover live before your eyes. We're here with cosmetic dentist Dr. Mary Viechnicki, and I've asked her to take her mask off now. How is it going? What are you doing?
It's going great. Right now we've isolated all the teeth, and we cleaned them up, and now we're just putting a desensitizer on to get ready to bond the veneers in place.
Okay, and we're going to come back later and see how the veneers get bonded in a couple of minutes, right?
Exactly.
Okay, and soon soon we'll be back with the dramatic results as well, so stay with us on NBC 10. NBC 10 News medical reporter Sherry Bank live in Allentown, where we're showing you how we get a perfect smile, a smile makeover. Look at this, a blue light special. We'll show you how we get a perfect smile coming up during Live at 5.
Time now to check back in with medical reporter Sherry Banks. Sherry's in Allentown showing us step-by-step as a woman gets her teeth veneered in a live smile makeover that you'll see only on NBC 10. Sherry.
Vince.
With the big smile. Tell us what's going on.
Listen, I want to jump in this chair next because we can't believe how good it's looking here. We're here with cosmetic dentist Mary Viechnicki, and she started this process here on NBC 10 News at 4. And right now you're bonding on the veneers. And do they stay on really well?
They're totally really strong. I mean, they're bonded into place, and you can brush and floss them just like you would your natural tooth individually.
And do they stain like regular teeth with coffee or tea?
No, they don't stain, which is great, which is why you can choose whatever color that you want, but you just have to go to your dentist, obviously, every 6 months to have a professional cleaning.
You still have to get them cleaned
Exactly.
and check for cavities and everything. Okay. All right, well, we're going to be back later, and you'll see how the process is going, and we're going to show you the dramatic results later. So we'll be back live here in Allentown.
All right.
Look forward to it.
I might be there next.
Yeah, me too.
Still ahead today on Live at 5, NBC 10 News medical reporter Sherry Bank is bringing us a live smile makeover. Sherry.
That's right, Vince. Not everyone has a dazzling smile like yours, so we're getting a smile makeover, a smile designed just for Renee here in the chair, and we're bringing it to you live, so stay tuned to see how it happens, and we'll show you the dramatic results coming up later. Stay with us.
Ahead on Live at 5, something you can really sink your teeth into. Our next story, Sherry.
Right, Tracy, I'm NBC 10 News medical reporter Sherry Bank live in Allentown, where we're showing you how to get the perfect smile live here on Live at 5. And we're going to show you one smile right here. We show the videotape that Dr. Mary Viechnicki did. And wait till you see that, how that fixed. And now we're going to show you pretty soon what Renee looks like. We've been working on her since 4 o'clock. We'll be right back, and we'll show you some dramatic results later in our broadcast.
On the NBC 10 Health Watch today, Live at 5, we've been witnessing an amazing transformation tonight, a live smile makeover. Let's check in with NBC 10 News medical reporter Sherry Bank. She's in Allentown. That's where it's all happening as we speak. Sherry, how's it going?
It's going great, Vince. I'm telling you, wait till you see how good Renee looks. It's just amazing. And this is a smile makeover. It's not a tooth whitening, not a bleaching. It's actually reshaping the teeth and putting on veneers. And it all started right here in Allentown last week.
Renee Munzinski is getting a new smile. She was sick of her discolored teeth and one tooth that's rotated.
The tooth doesn't sit flat with the others, that it's turned this.
Oh, I see. And that bothers you?
Yes. It bothers me a lot because when I smile and then I close, sometimes it gets caught, and that's just awkward.
Cosmetic dentist Mary Viechnicki is giving Renee a smile makeover. She uses a laser to move up her gum line to make two teeth look longer, then shapes other teeth.
If you've got a better smile, first of all, I think you have better self-esteem. You know, you just feel, wow, I am so good looking right now. I mean, overall, I think that does more than any type of facelift can do.
Because Dr. Viechnicki is not just whitening or straightening Renee's teeth, she's preparing them for porcelain veneers.
Veneers they close spaces, they can change the overall shape of the teeth, which is what somebody like me does. I mean, I treat and change a smile.
Take a look at one of her creations. Not bad, eh?
So, Dr. Viechnicki, now that you're finishing up here with Renee, what is it that you're doing? What is it that you have to do?
Well, right now we're just looking to make sure that the line angles are perfect, and also another really important thing is that the bite, that the teeth fit together how they should, and that she's not hitting anywhere where she shouldn't be.
Because as you told me, just if they look good, you still have to be able to bite and chew, right?
They still have to be functional.
Right. But there's a lot of artistry to this. You can't go to just anybody who does a bad job.
No, definitely. They definitely should be somebody who, you know, you should be able to look at their before and after books that they did exactly, because they themselves have to be an artist along with their ceramist who they send, you know, the teeth to.
So the ceramist is the one who makes the veneers.
Correct, exactly. And then when we insert them, we have to be able to look at them and say, okay, now that they're in the patient's face, are the line angles exactly where we need? Is the shape exactly what we want? Because we can do some contouring to make the smile look awesome.
Right, and we're going to show what Renee looks like as soon as you finish up here, probably on NBC 10 News at 6 o'clock, okay?
Great.
So get her ready, finish her up, and we'll be back at 6 o'clock and show that beautiful smile and her before and after pictures, okay? It's dramatic. Stay tuned. Stay with us because you'll see the dramatic results. Let's see. Great.
Wait, hold on.
Sherry, can you hear me?
We're looking at Doug's teeth. Go ahead, Vince.
Sherry, can you hear me?
I can hear you, Vince, yes.
Hey, listen, what I was really amazed about is that these veneers look incredibly natural, unlike the old caps.
That's right. Vince is saying the veneers look incredibly natural, unlike the old caps.
Well, exactly. First of all, they're all ceramic. It's an all porcelain material, which is really thin, like contact lens and thinness. And they have some great translucency at the bottom of them, so they should have just a natural look to them. And they should be, you know, just look wow.
Instead of those big chiclets that you used to look at people and go, oh, horrible teeth there.
Right, why would you want that?
Right, but now you say what? People should look at you and just say, nice smile,
and
right?
just say you have a great natural smile. What did you do? Did you whiten? Did you do something? I mean, it should be so perfect that it just looks like you were born that way.
That's great.
Yeah.
And that's what they're looking like. Oh, they're great. I want to get them. But then everyone would know, wouldn't they? Okay, we'll be back soon.
All right, Sherry, thanks very much.
Also tonight, we are just minutes away from the results of our live smile makeovers. Sherry?
I'm NBC 10 News medical reporter Sherry Bank, live in Allentown. We've been showing you a smile makeover since 4 o'clock. We're about to show you the dramatic results. Don't miss them. I'm NBC 10 News medical reporter Sherry Bank, live in Allentown, where we're minutes away from showing you the results of our smile makeover. Is it for you? Stay tuned and see.
We have been watching the whole process unfold live right here on NBC 10. Since 4 o'clock today, we've been tracking a local woman's dream to get a $1 million smile. From step 1, the laser reshaping, to getting fitted for veneers. She is hoping to transform her teeth from dull to dynamite.
That's right. From drab to dazzling, we're now just moments away from the big unveiling.
And NBC 10 News medical reporter Sherry Bank is live again from Allentown to show us the results. Okay, Sherry, take it away.
Tim and Renee, who wouldn't want to get this $1 million smile? It is fabulous. Dr. Mary Viechnicki did a fabulous job. And Renee, do you love your smile?
Absolutely.
Oh, good. Let's take a look at her before and after smile that we have here. And I think it's just fabulous. Look at that. And what do you think of it?
I absolutely love it. I'll definitely smile more in pictures with my daughter, and I feel 100% more confident.
Really? Oh, I think it looks so great. It's just beautiful. It is dazzling and white, and you could pick how bright you wanted it too, didn't you? It's great. And we actually have another before and after picture of Dr. Viechnicki's work. We have a man. I thought that was so dramatic as well. Do we have some of that to show? Yes. There's a before and after picture of the man with the beard and mustache. Dr. Viechnicki, this is a lot of work for you to do.
Well, it is a lot of work. I mean, total time, like patient time, takes about 4 to 6 hours total.
Because you have a consultation and
Correct.
then the first appointment.
Exactly, where you use the laser to recontour the teeth, and then your third appointment then would be, you know, inserting the teeth to make the smile gorgeous.
Right, and you put on the ceramic, the porcelain, I guess, they're porcelain veneers.
Right. They're all ceramic porcelain veneers because that's really what you want, because you want that gorgeous translucency to shine through so the smile looks natural.
And so it doesn't look like the old chiclet smile that we used to see.
Exactly.
So we have to say that they cost $1,500 a tooth.
Correct.
You usually need to do how many teeth?
You need to do at least 8 to 10. It has to be in the patient's smile zone, so where they, you know, where the last tooth that you see in the smile should be where you stop the teeth in order to get, so that you can change the shape of the teeth. But it is $1,500 a tooth, but you should look upon it as an investment in yourself.
An investment in yourself, and that is one beautiful smile, boy. That looks great. I love it. Okay, well, that's just wonderful. You look wonderful, and it was a pleasure to bring this to you today. You're very good.
Thank you.
Okay, live from Allentown, Sherry Bank, NBC 10 News, with the perfect smile. Look at that.